In June 2025, the Department of Justice charged 324 people in connection with over $14.6 billion in alleged healthcare fraud. You heard that right. $14.6 billion, the largest healthcare fraud takedown in American history. Now, if you wonder why Medicare is suddenly changing how it pays for certain procedures, well, this is where it starts. Hi, I'm Hanh Brown. This is where AI, policy, and aging collide, and where your family fits into all of it. So in this video, I'll show you the fraud schemes that led to Wiser, why skin substitutes are ground zero, and how to evaluate what you hear about this program. Here's what that $14.6 billion means for your care. These were not abstract crimes. In one scheme alone, Operation Gold Rush, fraudsters exploited the stolen identities of more than 1 million Americans, real people with real Medicare numbers, 1 million people who did nothing wrong, who paid into Medicare their whole lives, who trusted the system to protect them. In one scheme out of Chicago, prosecutors say criminals use artificial intelligence to create fake audio recordings of Medicare beneficiaries giving consent to treatments they never requested. They fabricated beneficiaries' voices. They fabricated their agreement. The indictment states they submitted $703 million in fraudulent claims. The federal agent seized $44.7 million from their bank accounts. In Arizona, 7 defendants, including 5 medical professionals, were charged in the connection with approximately $1.1 billion in alleged fraudulent claims for amniotic wound grafts. According to the prosecutors, they targeted vulnerable seniors, many in hospice care, and received millions in illegal kickbacks from the billing scheme. The grafts were allegedly applied without coordination with patients' treating physicians to some superficial wounds that did not need this treatment in sizes far exceeding the actual wound. Some patients died within days or the same day of receiving these applications. See, the third scheme targeted Medicare beneficiaries through telemarketing calls. 49 defendants charged. They allegedly submitted $1.17 billion in fraudulent claims for genetic tests and durable medical equipment, services patients never requested, never received, or never needed. You see, there is one category of fraud that connects directly to Wiser, and that stands for wasteful and inappropriate service reduction. Medicare's new AI review program, that's what it is. So I'll show you that connection in a few minutes. These numbers come from multiple federal agencies. The Department of Justice led the prosecution. The HHS Office of Inspector General investigated the schemes. The CMS tracked the payments and blocked fraudulent ones before they went out. The IRS followed the money. The DEA tracked diverted medications. 15 million pills of controlled substances allegedly distributed illegally. These are federal indictments with seized assets and people in custody. CMS alone prevented $4 billion in fraudulent payments before they went out the door. They suspended or revoked billing privileges from 205 providers. 96 doctors, nurses, and pharmacists were among those charged. People with licenses, people patients trusted. That betrayal is part of why this happened. Assets seized included $245 million in cash, cryptocurrency, and luxury vehicles. This was documented, prosecuted, and announced by the Department of Justice. One scheme alone involved $10.6 billion in alleged fraud. The Operation Gold Rush. You could look that up. A Russia-based criminal organization allegedly bought American medical supply companies using foreign straw owners. They allegedly submitted $10.6 billion in fraudulent claims for urinary catheters and other Medicare equipment using stolen identities of over 1 million Americans. You see, 4 defendants were arrested in Estonia. 7 more were picked up at the U.S. airports and border crossings. The DOJ seized $27.7 million from their accounts. So this was not a few bad actors running a small scam. According to the DOJ, this was organized crime, transactional, sophisticated, and systematic, targeting Medicare. So here's what matters. The DOJ data analytics team caught them by detecting anomalous billing patterns. Machines noticed that humans could not see in millions of claims. So that is the same principle behind Wiser, pattern detection at scale. Some say this justifies Wiser, which is, again, the Wasteful and Inappropriate Service Reduction Program. Others say it's an excuse for more government control over their health care. Well, you deserve to evaluate both arguments. Critics argue that fraud enforcement should be separate from care reviews. Catch the criminals, yes, but do not make the honest patients jump through hoops to get legitimate treatment. Well, that's a fair concern. Well, here's the counter-argument. The DOJ Criminal Division, headed by Galliardo, he puts it bluntly, these criminals didn't just steal someone's money, they stole from you. Every fraudulent claim, every fake billing, every kickback scheme represents money taken directly from the pockets of American taxpayers. The CMS administrator also added this. Traditional enforcement catches fraud after Medicare has already paid. By then, the money is often gone, overseas accounts, cryptocurrency, luxury cars. Wiser is designed to prevent fraudulent payments before they happen. A 2019 study in the Journal of American Medical Association estimated that up to 25% of healthcare spending in the United States may be waste, fraud, unnecessary services, and administrative inefficiency combined. 25 cents of every healthcare dollar. That is not sustainable. Remember the fraud category I mentioned, the one that connects directly to Wiser? Well, we're about to see it. Medicare Advantage already does this, and the numbers tell the story. According to the 2022 study published in the JAMA Health Forum, people on Medicare Advantage receive 9.2% fewer low-value services than people on original Medicare. Low-value services means treatments with little or no clinical benefit, procedures that cost money but do not help patients. Medicare Advantage plans use prior authorization to filter these out. Original Medicare, until now, has not. The skin substitute numbers show what that difference looks like in dollars. In 2024, Medicare Part B spent over $10 billion on skin substitutes alone. That's a dramatic increase since early 2023. The HHS Office of Inspector General flagged this as a major concern requiring urgent action. So now compare. Medicare Advantage plans, which use prior authorization, spend only 7% of what Part B spent on their same skin substitute products. 7%, not 70%, but 7. Same products, same patients, different oversight, dramatically different spending. That gap represents billions of dollars, and it raises a hard question. If prior authorization prevents this much waste in Medicare Advantage, why has original Medicare not used it? Well, more than 80% of health insurers are already using, planning to use, or exploring artificial intelligence and machine learning in their operations, well, according to the NAIC. Wiser is not inventing something new. It's bringing the original Medicare, what the rest of the insurance industry already uses, skin substitutes. That is on Wiser's list. Now you know why. Knowing this changes how you evaluate every Wiser story that you hear. Wiser targets specific services, not random procedures. The target list includes skin and tissue substitutes, select DME-related services, spinal procedures, and nerve stimulators. Every one of those categories has documented concerns about improper payments. So the HHS Office of Inspector General has audited and flagged billing risks in skin substitutes and spinal pain management services. False Claims Act settlements in healthcare hit $1.8 billion in 2023 alone. So here's your framework. When you hear about Wiser, ask one question. Is the service on the documented concern list? If yes, the review exists because of documented billing problems. If no, it is not part of Wiser. The next time someone tells you Wiser is government overreach, you now have the numbers: $14.6 billion in alleged fraud in one takedown, $10.6 billion in one scheme, $10 billion in skin substitutes in 1 year. You see, that's not theory. This is documented activity targeting a program you paid into your entire working life. So have you or someone you know been affected by Medicare fraud or had a claim questioned for one of these services? Well, put yes or no in the comments. I'll read them. Now, at the beginning, I mentioned one category that connects directly to Wiser: skin substitutes, $10 billion in 1 year. A dramatic increase since early 2023. Medicare Advantage plans spending 7% of what original Medicare spent on the same products. Now, skin substitutes are on Wiser's review list. That's not a coincidence. That is cause and effect. Your Medicare coverage has not changed. Your doctors are still your doctors. Your protections are still your protections. Wiser adds a review step for 17 specific categories of services. Services with documented billing concerns and billions of dollars in questionable payments. So you came to this video wondering why Medicare is doing this. So now you know. Understanding the fraud problem does not mean you have to support every detail of Wiser, but it means you can evaluate the program based on evidence, not just headlines. So in the next video, I will cover how AI and humans actually work together in Wiser decisions. Who reviews your claim? What role the algorithm plays? And what happens when they disagree? If navigating Medicare feels harder than it should, I understand. I'm building Medicare Brain, a tool that answers your Medicare questions instantly. Plain English, no hallucinations. Every answer comes with a receipt, the exact CMS page or regulation, so you can verify it yourself. Now, if you want early access, drop Medicare Brain in the comments.